by Dr. Shreya Pai, who will be presenting a case of intradermal nevus in the right eye.
Good morning, everyone. So my paper for today is a case report of intradermal nevus in the right eye. So coming to the introduction, nevus are pigmented growth on or in the eye which are made up of melanocytes. They are benign tumors which can be congenital or acquired. So the benign pigmented lesions of the eyelid include congenital melanocytic nevus and acquired melanocytic nevus. And the acquired melanocytic nevus are further divided into junctional, compound and intradermal. And the conjunctival melanocytic tumors include nevi, which are further divided into junctional, subepithelial, compound, blue nevus and congenital melanocytosis. The second one is the primary acquired melanosis, which can be with or without atypia, and the third one is melanoma. So coming to the case, it was a 31-year-old female who presented to the oculoplastic clinic with complaints of brownish discoloration in the right eye since childhood. It was painless and gradually progressive in nature. The patient also complained of swelling in the right lower lid, which was present since 7 to 8 years. There were no complaints of diminution of vision, pain, pricking sensation, watering or discharge. There was no history of trauma or ocular surgeries in the past, no similar complaints in the family and no systemic comorbidities. Coming to the examination, the patient was conscious, cooperative, well oriented to time, place and person. There was no pallor, icterus, cyanosis, clubbing, lymphadenopathy or edema. Pulse rate and BP was normal. The systemic examination was normal. S1, S2 was heard. There was bilateral normal vesicular breath sounds and no focal neurological deficit. Coming to the ocular examination, head posture was normal. Ocular posture was orthotropic. Coming to the right eye, the vision was 6/6. There was a non-pigmented dome-shaped swelling measuring 2 into 2 mm in the lower lid. The conjunctiva had a melanocytic lesion in the interpalpebral conjunctiva measuring 7 into 8 mm extending from the limbus. It was flat with few cystic spaces varying from tan to dark brown in color. Cornea was clear, pupil was 3 mm and reactive to light, lens was clear. The left side was within normal limit. The extraocular movement was full range in both eye. Gonioscopy was done, which was open angles in both eye. Fundus was within normal limit. So this is the clinical picture which shows the conjunctival lesion and a dome-shaped swelling in the lower lid and the slit lamp examination. So an ultrasound biomicroscopy of the right eye was done, which showed superficial involvement without intraocular spread. Coming to the management, so excision biopsy of both the lesions was done and sent for histopathological analysis. The lid lesion showed epidermis with the nevus cells which were arranged in nests with no junctional activity, which was suggestive of intradermal nevus. This is this histopath picture. And the conjunctival lesion showed nevus cells below the epithelium suggestive of subepithelial nevus. These are the histopathological pictures showing the nevus cell just below the epithelium. So these are the post-op pictures, post-op day 7 and post-op day 14, which showed complete removal of the pigmented lesion. So coming to the discussion, so these lesions are very common. So clinical examination is important to differentiate between the benign and malignant lesions. Definitive diagnosis is by histopathological examination. And in case of conjunctival lesions, UBM can be done to detect the extent and the depth of the lesion. Coming to conclusion, intradermal nevus is the most common acquired melanocytic lesion in the eyelid. It is of importance to differentiate it from malignant lesions like basal cell carcinoma, as early diagnosis and treatment is of utmost importance. Nevi are the most common melanocytic conjunctival tumors which have a risk of 1% malignant transformation. And this case illustrates the importance of clinical and histopathological examination in accurate diagnosis. These are my references. Thank you. Yes, ma'am.
Was it also removed?
Yes, ma'am. Both the lesions were removed, the
And-
conjunctival lesion and the lid lesion. The lid lesion showed it was an intradermal nevus, and the conjunctival nevus showed that it was an subepithelial melanocytic.
And how do you describe the lid lesion?
The lid lesion was a non-pigmented a dome-shaped lesion which was around 2 into 2 mm without any pain tenderness, and it wasn't there was no fibrosis or anything below the skin. It was freely movable.
I guess you said some right eye lower lid pain or something when you were presenting, right?
No, ma'am. There's no pain, no symptoms. She had no symptoms of pain. Only her main complaint was cosmetic, and it was gradually progressive. So she just wanted to get it examined to rule out any malignant components.
So what were the surgical steps that were done to remove the nevus? You didn't explain that.
Ma'am, it was just for the lid lesion. It was just a shave biopsy. For the conjunctival lesion, it was complete excision, and it was just cryo which was applied after the excision to the conjunctiva. No suturing, nothing was done.
That should have been in this.
Okay, sure.
Okay, and what is the post-operative management?
Post-operative, we just started her on antibiotic and lubricant, ma'am, and we waited for the histopath report. So after the histopath report, after we were sure that it's not a malignant lesion, we just asked her to continue the lubricant and to come back to us if there is any other complaints or if there's a regrowth of the lesion.
Thank you.
Thank you.